Good afternoon, ladies and gentlemen, and welcome to Vision Health Month 2022 Summit. This afternoon we have a unique panel of experts and friends of the vision loss community that are going to discuss a national health strategy, a vision desk, and more research dollars for vision. But before we go there, I would like to recognize and honor the Algonquin Nation, First Nations, Inuit, Métis peoples. The CCB acknowledges that Ottawa, home of our head office, is built on unceded Algonquin Anishinaabe territory. The people of the Algonquin Anishinaabe Nation have lived on this territory for millennia. Their culture, their presence, have nurtured and continue to nurture this land. The CCB honors the peoples and land of the Algonquin Anishinaabe Nation. The CCB honors all First Nations, Inuit, Métis peoples, and their valuable past and present contributions to this land. Along with the Government of Canada, we at the CCB are committed to a renewed nation-to-nation relationship with Indigenous peoples based on the recognition of rights, respect, cooperation, and partnership. I would also like to take this opportunity to speak of the support that the CCB gives to the people of Ukraine in their fight against a terrorist nation, Russia. The CCB is hoping and has discussed with various peoples about the European Union and the world blind community supporting those people living with vision loss and all peoples in Ukraine, but specifically those people living with vision loss, and making sure that they're properly being cared for. We dressed in the colors in support, so. And now I'd like to introduce the first speaker, Dr. Keith Gordon, a Senior Research Officer for the Canadian Council of the Blind, a good friend, and if anybody has a tea time on Thursday, he'll fill in with you, but he likes walking. Dr. Gordon.
Okay, thank you very much, Mike. Thanks for your getting a tea time for me for Thursday. That's very helpful. To set the scene for the three issues that Mike has already mentioned, I'd like to just give you a little bit of the background of how we got to where we are today. In December of 2020, the Canadian Council of the Blind commissioned Deloitte Access Economics, who are a consultancy based in Australia that have a tremendous amount of expertise in the area of health economics. We commissioned them to conduct an updated assessment on the prevalence and cost of vision loss using 2019 data. The data that was being used throughout Canada for planning of vision health to that date was using 2007 data that had been reported in 2009. So the data was at least 12 years out of date. We thought it was necessary to do an updated study, and the results of that study was released in May of last year, May 2021. That study showed that there an estimated 1.2 million Canadians living with vision loss. In addition to the 1.2 million Canadians who currently have some level of vision loss, there are about 8 million Canadians who are living with an eye disease that may lead to blindness. These people currently are not showing any signs of vision loss, but if left untreated, they may lead to blindness in the immediate future. About 2.5 million of these people are living with age-related macular degeneration. 3.7 million are living with cataracts, about 1 million are living with diabetic retinopathy, and about 750,000 are living with glaucoma. So these people, we figure, are really important to focus on these folks, because if we don't, they're going to lose vision, and that number of 1.2 million is going to grow substantially. Second aspect of this study, we showed that the total cost of vision loss in Canada in 2019 was $32.9 billion. This consists of a total financial cost of $15.6 billion, that's real dollars, and a lost well-being cost of $17.4 billion, which is not, they're not real dollars, they're not a financial cost in the sense that you can put that money in the bank, but it is a metric used by health economists to assess the impact of a particular disease or condition. And the other important, there were a lot of other findings, but one of the other important findings that came out of the study was that we showed that the total spending on vision health research in Canada in 2019 was $20.9 million. We were talking billions, now we're talking millions. In a country where the health research budgets run into the millions, we think it's absolutely appalling that a measly $20.9 million is spent on vision health research. And Doug Earl is going to talk about this in more detail a little later on. So out of this set of the findings of the study, we came up with a whole set of recommendations. There were actually 26 recommendations, but there were 3 that stood out, and that's why we're here today. The first one is that we recommended that there should be a national vision health plan for Canada. Secondly, and I'll talk about each of these in a little more detail. So there should be a national vision health plan for Canada. Secondly, there should be a vision health desk within the Public Health Agency of Canada. And thirdly, that there should be increased vision health research funding. So let's go back a bit to the National Vision Health Plan for Canada. Canada is in desperate need for a far-reaching, coordinated national plan for vision health. There is no such plan. Most diseases have a plan. You can find a cancer strategy for Canada. You can find an Alzheimer's strategy for Canada, but you can't find a vision health research plan. And this isn't for want of trying. The government of Canada has made several commitments to developing and implementing such a plan, but has failed to deliver on these commitments. In 2003, that's going back almost 20 years now, the Canadian government made a commitment to the World Health Organization at the World Health Assembly that they would develop a vision health plan for Canada by 2007, and they would implement this plan by 2009. Here we are in 2022, and there's still no such plan. In 2013, and again in 2020, the Canadian government made similar commitments at the World Health Assembly, and then in July last year, the Canadian government supported a unanimous motion in favor of vision health at the United Nations General Assembly. And this isn't casting aspersions at any one particular government. We've had 2 parties that have been in power over that period of time. Those commitments have been made by both parties, and today we're sitting without a plan. The other recommendation, the second recommendation we made was that there should be a vision health desk at the Public Health Agency of Canada. Vision issues currently are being handled by various departments within the Public Health Agency that deal with other diseases and conditions. For example, a large chunk of vision health issues are dealt with on the diabetes desk. Well, you can bet that diabetes is going to get priority when it comes to vision issues. The number 1 issue is diabetes. Number 2 issue is going to be vision. So it's really important that we have a vision-specific department that clearly focuses government efforts on the prevention, research, treatment, and, I'm looking at Jennifer Jurosevich, rehabilitation of vision loss. And thirdly, we recommended the increase in the funding for vision health research. As I mentioned, it's woefully inadequate. We have to invest to find treatments for blinding eye diseases and life-changing technologies for people currently living with vision loss. So it's not only treatments to cure eye diseases, but we also want to look at technologies that are important to people currently living with vision loss. Technologies have totally changed the way people with vision loss integrate into society, and it's important that we keep developing similar technologies and putting the funds towards research that's going to get there. So these results and recommendations were all done pre-pandemic. The pandemic has just amplified the need for these three recommended measures. We did a study last year as an addendum to the initial study and showed that things had only gotten worse, and the need for these three conditions, these three recommendations, has only grown. And with that, I will pass it over to you to carry on.
Thank you, Keith. I'd just like to point out, Keith is talking about the cost of vision loss and blindness study in Canada. And later on, Doug is going to be talking about the stopvisionloss.ca. I think it's important to note that for the first time in a long time, for the cost of vision loss study, 14 different entities came together to help fund it. And those weren't just one area of stakeholder, or it was multiple areas of stakeholders from across the spectrum of people that participated. And then if the camera could hone in on the Stop Vision Loss and the Vision Health 2022 sign up there, you will note that for the first time in my 17-year history with the Canadian Council of the Blind, all 10 major stakeholders in the vision loss community came together. The presidents and the senior managers and the chairs of the board and the executive directors came together and signed a letter requesting that the government participate and get us a vision national vision health strategy. With that, I'm going to introduce Carol Hughes, a member of Parliament representing Algoma, Manitoulin Island, and Kapuskasing, and Assistant Deputy Speaker, who just got in from a vote in the House, from what I understand. So Carol's here today because she's a proponent of vision loss and people preventable blindness. So we've asked her to come today and let her address the area that she feels comfortable in. So with that, I give a warm welcome to Carol Hughes, please, Member of Parliament from Kapuskasing.
Well, thank you very much. Very kind. First of all, I also want to acknowledge the traditional territory of the Algonquin Anishinaabe people that we are on, and really appreciate you including that in your opening remarks as well. It's all part of the acknowledgement. It's all part of the reconciliation, and it's all part of the education piece that we need to continue moving forward. So thank you very much. I want to thank you for inviting me to speak to Canadian Council of the Blind's Vision Health Month Summit. I want to thank the organizers, including the Council and the Capitol Hill Group, as well as their partners, including the Canadian Association of Optometrists, Fighting Blindness Canada, the Canadian I should get that one straight because my future daughter-in-law is just starting her residency in ophthalmology. So, so the Canadian Ophthalmological Society, the CNIB Foundation, Diabetes Canada, the International Federation of Aging, Vision Loss Rehabilitation Canada, Balance for Blind Adults, and the Opticians Association of Canada. That should be the easiest one. So in my time as Member of Parliament, I've been fortunate to be able to advocate for a number of issues that I care very deeply for, and one of those issues I have had the pleasure to advocate for consistently has been vision care. And as I mentioned a few minutes ago, is that my daughter-in-law is just starting her residency. She was hoping to do it here in Ottawa, but she got accepted in Montreal, so she's going to be doing it there. And I also have, my husband is diabetic and is having eye health issues, of course, and I always say he became a diabetic at age 24 just because I was too sweet for him, because that's when we got married, and that's when he was diagnosed. You know, as my time and as a member of Parliament, as I've indicated, I've been advocating for these issues. And as a New Democrat, I've worked tirelessly to advance public health care and expand services that fall under the auspices of the Canada Health Act. As many of you may be aware, thanks to the work that our caucus, the NDP, has done, especially with this year's budget and with the government, we came into an agreement that saw the single largest expansion in public health care in Canada in over 50 years, with the inclusion of $5.3 billion towards the development of a dental care program. I know many of you are probably thinking, well, why not vision care? But, you know, certainly it's not something that we have taken lightly. This is a step in the right direction, and, you know, our goal is to continue to work with the government to, this is what we were able to get out of them, but it doesn't mean that it stops there. What it means is that we will continue to work forward. So we also have commitments from the government to start developing a universal Pharmacare program this year, and while these are great steps towards head-to-toe public health care, again, you know, missing is the commitment on vision care, and as you've indicated, there has been previous commitments made on a number of occasions, and it hasn't been followed through on, and that is something that we will need to keep their feet to the fire on. You know, you can make a promise, but if you don't act on it, you know, that's all it is just words, and in the meantime, people are suffering, people are doing without, and it is impacting our communities, it's impacting our economies, and I know that there are so many workplaces out there that are looking for employers or employees that, you know, this is a way that if we can put those investments in to the research, we can put those investments into some of the exciting technology that's being that is out there and waiting for approval, that we will be able to make a difference in those people's lives and in employers' lives and in our economy. Notre vision des soins de santé au Canada a toujours été une vision qui inclut tous les aspects de la santé, y compris ceux qui ne relèvent pas actuellement de la loi canadienne sur la santé, notamment les soins de santé mentale, les soins auditifs et en effet les soins de la vue. En ajoutant les soins dentaires et en graissant les roues pour inclure l'assurance médicaments, nous sommes plus près que jamais de réaliser notre but. J'ai eu le plaisir de déposer un certain nombre de pétitions à la Chambre des communes pour soutenir la santé oculaire et j'ai travaillé avec des organisations telles que l'Association canadienne des optométristes pour faire avancer la cause des soins de la vue à la Chambre. J'ai également travaillé avec eux à l'élaboration de plans pour une stratégie nationale d'action sur la santé oculaire et les soins de la vue. So basically, for those of you who are not bilingual, I just indicated that I've tabled many petitions in the House thanks to the Canadian Association of Optometrists who went out and got those. I made sure that we broke them out so we could keep them at the forefront. So, you know, for every 25 we were tabling, so we were able to table them more every day and put press releases out. The other thing is that I have been working with, thanks to the Canadian Association of Optometrists, on a national action plan, what that should look like for a national vision plan. It's stuff that I've been working on. I've tabled the motion in the last two parliaments, and so I'm getting ready to retable it in this parliament as well. So the motion itself basically talks about establishing an Office of Vision Health at the Public Health Agency of Canada, charged with working with provinces and territories on strategies for eye health, vision care, and full integration of post-vision loss rehabilitation therapy into the healthcare continuum. Enhancing funding for vision health research, which is something that the good doctor here just mentioned as well, and ensure representation on dedicated CIHR review and evaluation committees. Also ensure enhanced access to eye health and vision care for Indigenous peoples, seniors, and children, and ensure a consistent and reliable supply of medication required to treat eye diseases and or conditions, and engage in public information campaigns through the Public Health Agency of Canada to influence individual behavior and encourages Canadians to think about their eye health and vision care. And I think, we might need to look at including the fact that, for rural and remote communities, we need another piece in there, given the fact that it is extremely difficult to get services, and we saw that even during the pandemic, how difficult it was to access specialists, and it's even more difficult for people in rural and remote communities, given the fact that we don't even have much public transportation in those areas either, which is another fight that I've been trying to have with them, is to reinstate passenger rail. So that would help. So I talked already about the two motions that I had tabled, and so I'm going to jump that piece because I basically read what was inside. So the funding for vision health research is extremely important, because that is how we can actually move forward on these innovations that are out there, and we need to make sure that we can maintain the researchers, the scientists that are here, because we're losing a lot of them to other countries. And so we need to make sure that we can compete with what the other countries pay, and we need to make sure that we're serious about taking their knowledge and their research seriously in order to be able to make the difference. So while working with the Canadian Association for Optometrists to develop these motions, we tried to ensure that we looked at a vision care through a non-partisan lens. The framework was developed so that anyone who looks at it will recognize that it is a common sense solution to vision and eye health issues. I am pleased to have worked with the Canadian Association of Optometrists on this framework, and was honored that they had named me their Vision Champion for 2021, a title I was thrilled and humbled to accept. The issue we find ourselves in now is that vision-threatening conditions are increasing as both a result of an aging population and because people have delayed eye exams for a multitude of reasons, such as pandemic restrictions. Of those issues we should really be focusing on is age-related macular degeneration as well. So according to the Canadian Ophthalmological Society, age-related macular degeneration is one of the most common eye diseases to cause vision loss after age 60, affecting nearly 2.5 million Canadians and accounting for 90% of new cases of legal blindness in the country. I did recently meet with representatives from Nova Oculus who are anxiously awaiting Health Canada regulatory approval for a device that uses microcurrent waveforms directed towards the retina that, at least in initial trials, seems to have a positive effect on reducing the symptoms of AMD. So while I am aware that there are no long-term treatment options currently for dry AMD, the most common type, I am hopeful that going through the Health Canada regulatory approval process will yield positive results. But again, that process takes a while, and we need the government to recognize, we need Health Canada to recognize that that time is not on the side of individuals who are have these kinds of conditions. Been also dealing with rare diseases as well, where some of their medication is being, the research that's gone on and the positive impact that's had on in other countries, how it still takes a long time here in Canada to have that approved. And I know we have to be conscious of safety, but we also have to be conscious that people don't have time, such as people with ALS, and people who have vision impairments, right? So if there's opportunities there, we have to look at those opportunities and take them and say, okay, so how do we actually move this forward much quickly? So while we focus on mainly the health aspects of vision care, the effect it has on people's health also spills onto either other facets. Obviously, when a person is healthy, they take less time away from work and are more productive. In the 2018 report, Dr. Michael Dennis, former president of the Canadian Association of Optometrists, laid out the impacts of vision care issues on the economy quite clearly. According to the report, $15.8 billion is spent on the direct cost associated with vision loss each year. Vision care issues could also be attributed to $8.1 billion spent on the indirect costs, such as caregiving for those with vision loss issues. 1 million Canadians missed work due to vision issues in 2016. And I have to assume those numbers are higher today, particularly since many of us have spent the better part of the past 2 years on Zoom and using just our computer as opposed to working directly on a person-to-person basis. So this is why we must continue to work towards developing a comprehensive national strategy for action on eye health and vision care. It's not enough to sit back and hope for the best. We need to act now and ensure that Canadians can, pardon the pun, take the long view of eye care. Thank you very much. Appreciate it. Merci, miigwech. Oh, and sorry, I totally forgot, if you can bring my bike back. I do want to introduce just briefly my intern, Olha, who is from Ukraine. So the government of Canada actually, or the parliament, the Ukraine intern program brought 41 interns as opposed to the regular 12 interns per year maximum that they usually bring. And Olha is studying at Carleton right now since September, and she has been placed in my office, and I'm really pleased, and I know that she's really touched by your show of support here as well today. So, and she'll be joining us tomorrow as well for the gala dinner, the awards dinner. Thank you.
Thank you, and welcome. Welcome. I'm glad to see that you were able to make it this afternoon, okay? And our best wishes to your friends and family back home. Thank you, Carol. I will say there's probably, how many people here? 40 people here? They all would like to sit down and have a long conversation with you. No, thank you. I think what you're stating is really important. And I will tell you, we've got about, I don't know, 3,000 or 4,000 people that have signed that petition for all three that we might throw at you 25 at a time.
Just give them all to me. I'll split them up.
With that, I'd like to introduce a good friend of the CCB's, who's somebody that when Dr. Gordon and I ran into brick walls and needed help and were overloaded and everything, that Dr. Chad Andrews came to our rescue. Chad is presently working with the College of Optometrists of Ontario and is a good friend of the CCB, and you'll see his name along with a number of other people's names as part of the investigators and writers. And before I go to, I would also like to introduce Larissa Monez, because she has been a very important role in some of the writings and different things that we've done too. So thank you, Larissa, and I'm glad you could make it today. Chad?
Thanks, Michael, and hi, everyone. My name is Chad Andrews, and I'm a policy analyst and researcher at the College of Optometrists of Ontario. I've also been very lucky, as Michael mentioned, to work with both the Canadian Council of the Blind and Fighting Blindness Canada on various vision-related initiatives in the past, including research projects, submissions to CADIF and other regulatory bodies, and more. I'd like to start by thanking the organizers of this summit, particularly CCB and the tireless Michael Blargian, for inviting me to be part of this panel and for all the work that goes into making this kind of event happen. I used to actually be involved in some event planning once upon a time, and after the first few lunches and talks where nothing came together, no one got the drinks or the food that they wanted, and the event spaces were woefully inadequate, I was quickly shuffled off to do other things. So, in other words, I really appreciate all the hard work and the expertise that goes into making this kind of thing happen, including today and tomorrow. Keith gave a great overview of the role of a vision health desk and how it could play into addressing the challenges and complexities of preventable vision loss and blindness in Canada. I'd like to spend a bit more time with that notion, first by expanding on Keith's overview, and secondly by offering some very brief thoughts on the value of cooperation and coordination, which is really what a Vision Health Desk would facilitate, specifically from the perspective of health regulation, which is the world that I currently inhabit. First, it's very clear, especially after Keith's introduction, that eye diseases constitute a disease category in Canada that demands our resources and our attention. According to the study using 2019 data, and I'm going to repeat some of what Keith had already said at the outset here, but I really do think that it's the core of what today is all about, or at least the evidence base. According to that study, which I was very lucky to play a small role in, 1.2 million Canadians live with vision loss. More than 8 million live with an eye disease that has the potential to lead to vision loss or blindness. And those numbers aren't getting any better. Carol gestured towards this already. Previous research done by Keith and others has shown, and we may have a chance to dig into the numbers, that Canada's aging population will lead to a significant surge in both prevalence and economic impact over the next several years. Those numbers are especially meaningful because research has also shown that eye diseases are enormously burdensome, both physically and psychologically, and that they impact one's career, family, finances, and overall well-being in ways that are both life-altering and at the same time very difficult to quantify. On top of this, vision loss and blindness costs almost $33 billion in 2019. That's a staggering number, making it clear that it is essential from not just a public health perspective, but also an economic one, that more is done collectively to address this issue. What role can a Vision Health Desk play in this? Keith made this apparent already, but the idea is relatively straightforward. All of the initiatives and endeavors that we'll discuss today, from research to treatments to public awareness, would benefit from coordination at the highest level of government. Rather than having one initiative over here in Newfoundland or Alberta or the Northwest Territories, and another separate one in Ontario or some other province, we can pool resources and knowledge to systematize efforts and jointly address what is a truly national health issue. This would also help to ensure that smaller regions and demographics can benefit from what is happening in larger jurisdictions. That, for example, advancements in urban healthcare and treatment can benefit optometrists, ophthalmologists, and other vision health providers in Canada's rural and remote areas. The Public Health Agency of Canada already maintains several departments or teams focused on cancer, dementia, the opioid crisis, and other areas, but nothing specific pertaining to vision. As with the Canadian Institute for Health Research, which Doug will address shortly, vision is nestled within other disease categories. With CIHR, it exists under an institute focused on aging, and in the case of public health, vision is dispersed across a range of other departments. What this means, of course, is that the uniqueness and complexity of vision loss in Canada gets lost in the shuffle. With CIHR, we see this in the form of inadequate funding. And with public health, we see it in the lack of a national vision health strategy, the lack of a coordinated research strategy, the lack of a public awareness campaign, etc. On the topic of public awareness, it is worth noting that there is a strong public appetite for more and better communication. In 2020, FBC, CCB, and other stakeholders developed a series of white papers focused on patient experiences, access to care, and research. These were based on survey data received from researchers, health professionals, and hundreds of Canadians with lived experience of vision loss. The respondents indicated that by enhancing understanding and awareness, public campaigns could not only spur research and other initiatives, but also combat the discrimination and social stigmas associated with vision loss and blindness, and perhaps even begin to dismantle some of the barriers that those in the vision loss community face in relation to employment, social inclusion, and other areas. Now, a public awareness campaign is just one example of what a Vision Health Desk could coordinate, and the Public Health Agency of Canada is already active in this area. For example, earlier this year, they launched Canada's first national dementia awareness campaign alongside the implementation of a national strategy. The campaign in particular is designed to address the fact that, and I'm quoting from their website, Uninformed attitudes and beliefs about dementia can result in stigma, which can affect people living with dementia, their loved ones, and caregivers. Stigma can lead to social isolation, make people feel alone, and erode their sense of worth." End quote. A Vision Health Desk could lead and coordinate a similar strategy and campaign for vision loss and blindness. This is long overdue and would constitute a meaningful step towards addressing the personal, social, and economic challenges associated with vision loss and blindness in Canada. But at the same time, a Vision Health Desk could do more than coordinate a public campaign and national strategy. I don't want to take up too much time here, so I'll just list some potential activities. A Vision Health Desk could collect data across multiple research efforts, functioning as a kind of compendium or library for eye health research across Canada. It could coordinate action from governments, health professionals, non-government organizations, industry, and more. It could focus on access to care for communities at greater risk of losing vision, including Canada's Indigenous communities. This could include finding ways to provide individuals with eye care through the NIHB program. A Vision Health Desk could promote access to quality care in an equitable fashion, ensuring that Canadians receive the best treatments possible regardless of their socioeconomic status. It could promote the early detection of eye diseases as a means of preventing vision loss and saving the Canadian health system millions, if not billions of dollars. I think it's very clear that optometrists would play a crucial role here as they are the frontline workers of our vision care system. And finally, it could find ways to improve coordination across the health spectrum, including by fostering collaboration and research sharing among opticians, optometrists, and ophthalmologists. Now, I'm biased here because of where I work, but it seems to me that optometrists in particular have a very central role in our collective endeavor to treat and prevent vision loss. I actually had the opportunity recently to go to the University of Waterloo, where many Canadian optometrists are trained, and it was really incredible to see some of the cutting-edge work that they're doing there, whether it's lasers or it's virtual reality simulations of diseased eyes that students can actually work with. It was just such a pleasure and really overwhelming to see the amazing work that they're doing. I would love to see the ingenuity and innovation on display with what is happening with one group of O's, whether it be optometrists or ophthalmologists or opticians, be shared and promoted and nurtured by the other professions. That could only be a good thing, and a Vision Health Desk could play a role in that. Now, I mentioned at the outset that I would say something about a Vision Health Desk from the perspective of the regulation of health professions. For the last several years now, a global trend in the regulation of health professions has been, quote unquote, modernization, which is basically a catch-all for streamlining, coordination, and advancing evidence-based decision-making. In Ontario, for example, the Ministry of Health recently proposed changes to the regulation of health professions, including optometry and ophthalmology, that would place an added emphasis on coordination, transparency, evidence, and collaboration. And in fact, this form of modernization is already happening in some cases. Health colleges in Ontario recently completed their second annual report for the College Performance Measurement Framework, or CPMF, a tool that asks colleges to meet benchmarks in training, transparency, governance, equity, and other key areas. It's a way of ensuring, essentially, that colleges are coordinated, that they meet high standards, and that they adhere to a single, generalized pathway for the protection of the public, which is really what health profession regulation is all about in the first place. I'm comparing apples and oranges to some degree here. On the one hand, we have the regulation of health professions, and on the other, we have eliminating or at least curtailing vision loss and blindness. But I think it's useful to think about the benefits of modernization in the world of health regulation and how those systems and coordinated efforts could be applied to complex public health issues such as vision loss and blindness. Finally, it's also worth thinking about the role of health regulatory colleges in this particular discussion that's happening right now. Speaking on behalf of the College of Optometrists of Ontario, I know that we're very happy to be at the table discussing how we can move the needle forward on vision loss and blindness. We're anxious to learn more about how patients are being impacted, and we're looking forward to working with all the stakeholders in this room and attending online to find a way forward. Thank you very much.
while I introduce our next guest, I would like to recognize some people that are here in the audience. I would like to, President of the Canadian Council of the Blind, Jim Tokus. Please stand, Jim. The immediate first past president, national president of CCB, Louise Gillis. And the president of Vision Loss Rehabilitation Canada, Jennifer Jurozovic. I hope I pronounced that right. Thank you. And last but not least, the next president I've got to invite to speak. 2 years ago, 26 months ago, Doug Earl and I had our first conversation. We met at the previous 2020 gala, and since then, I think we've, joining with other stakeholders, I think we've accomplished a lot. And a lot of it's due to the president of the CCB allowing us to move forward at the pace we did, and that we had great partners, and none better than the president and CEO of Fighting Blindness Canada, Mr. Doug Earl.
Thank you, Michael. And it's an honor to be with Carol Hughes and Dr. Andrews and Dr. Gordon on this panel, because actually, to add to this, Michael, of course, it was in this room in 2020, the year of vision, that magic year, 2020, your perfect vision, that we had a summit about the vision priorities in the year 2020. And we looked at and talked about vision research. And it was exciting at that time to hear about the amazing things that were going on. And then to fast forward, just to pick up on both Chad and Keith's discussions around the number and why is it important, the number of people that are impacted by vision loss, and why it's important that we invest in research today. They've both talked about the fact that there are over 8 million Canadians living with a blinding eye disease that, if not diagnosed, that puts them at significant risk of losing their sight. That if they're not diagnosed early and they do not have access to treatment, they could go blind. And they don't have to. This is preventable blindness, and research has already delivered treatments that 3 out of 4 of those individuals, if they're diagnosed early and if they have access to treatment, can stabilize their sight. And in some cases, if early enough that it's diagnosed, can restore their sight and they go off treatment. That's the power of research. What Keith did not share, and Chad didn't share, is that today, though that 8 million people will grow to 13.9 million people by 2050. What Keith and Chad did share was 1.2 million Canadians living with uncorrectable vision loss. We have not discovered, research has not found treatments that will restore their sight. That number is going to grow to 2 million by 2050. So when you think that 1 in 5 Canadians today have an eye disease that could lead to blindness that we need to prevent, and if you think that 1.2 million Canadians are living with vision loss that we haven't, that's uncorrectable, we don't have treatments today, we wonder why the government of Canada hasn't fulfilled its 5-time promise since 2003 to develop a vision health plan to do something about it. And one of those key planks is investing in vision research. And it does make a difference. My panelists have talked about the $32.9 billion social economic cost that in 2019 we found. But that number in 2019 dollars, so excluding inflation, will, and that's probably a little bit more now than when we looked at it these days, that number is going to grow to $56 billion in 2050. So just for the bean counters, you know, that has a direct impact on Canadians. But it's also the people who are living with those eye diseases. And, you know, Carol shared the story of her husband that's living with diabetes and the complications of diabetes that lead to vision loss. In fact, 20 years after diagnosis of someone with either type 1 or type 2 diabetes, over 90%, according to Dr. Brandt, will develop diabetic retinopathy, one of those diseases that are driving that 8 million number. So we have a responsibility. We have an interest in the individuals that are living with these conditions or will develop those conditions by 2050 to do something about it, or else our healthcare system is at risk. Because we cannot handle the number of cases that will develop unless we develop new treatments, and that's why research is important. And this is an amazing moment in time for research. You know, science theory that was talked about years in my career, over 30 years I've been involved in raising money for health research, things that were thought about, talked about, ideas, they're actually happening in the eye. They are now reality. They are treatment reality. And one of them is a new gene therapy, the first one approved by Health Canada in this country, Luxturna. In clinical trials, over 90% of the people had their night vision restored by replacing a defective gene, RPE65, with a gene that functions and produces that biochemical process to restore night vision. Unbelievable, things that you didn't think about. Well, at Fighting Blindness Canada, Larissa and I spent all the time monitoring these clinical trials around the world. We track 70, 80 new gene therapies, new treatments that are moving from the lab into human treatments in clinical trials around the world. And we are Fighting Blindness Canada is making investments, thanks to our supporters, to get those treatments, those clinical trials into Canada. You know, we made a key investment in Montreal, and we went from 3 clinical trials to over 10. We made an investment in Toronto to bring someone back from Harvard that's now opening up, working with sick kids and the University Health Network, Kensington Health, Sunnybrook, the hospitals, to be able to bring Toronto to the same impact that we've been able to do in Montreal because of these investments. So clinical trials could be available in Canada to access these treatments here, now. And the amazing investments that have been made to help with some of the other diseases like age-related macular degeneration, diabetic retinopathy, the cataracts and glaucoma that are happening in order to improve those treatments in Canada and around the world. That's the power of research. You know, there's amazing opportunities with optogenetics and stem cells around the corner that only need help, only need investment in order to discover and become those research theories becoming treatment reality for people. You know, it's not just the basic science as well. Fighting Blindness Canada is very proud to be an investor in health systems research. Did you know that people living with diabetes in Ontario, that over 60% are taking advantage of a publicly funded regular eye exam in order for that early diagnosis to happen? But what about the other 40%? How can we make the system work better that those people can access a regular eye exam that is publicly funded at any age as well. And we're proud to be funders of that research, thanks to our supporters, that are targeting the demographics that are most common not to get that regular eye exam. And we're supporting a research project with 3 community health centers and the University of Toronto to be able to figure out how, because when the pilot was done by this research group, over 90% of people took advantage of that regular eye exam. And it was frightening to know that 5% of them had developed diabetic retinopathy, had progressed, that there was bleeding in the eye, and they urgently needed treatment in order to stop the damage that was leading to blindness. 27% of those people had diabetic retinopathy that were not getting regular eye exams, and 35% had other blinding eye diseases that were undiagnosed, that could, with early diagnosis and access to treatment, could be stabilized for 3 out of 4 cases. That's health system research that we're proud to be funding. Our work is in an effort to support the development and investment in research in Canada. And it's interesting to look just south of the border, where there is a National Institute of Health, just like we have the Canadian Institutes of Health Research in Canada. In the United States, that NIH, for short, supports an institute, the National Eye Institute, and they have an annual budget of $835 million US. In Canada, compare that in Canada, we have 13 institutes as a part of the Canadian Institutes of Health Research. Not one of them is dedicated, as Chad noted, to eye health. Just imagine if we could take 10%, just proportional to population, and invest in Canada, when Keith noted that we could only find in the study that was done in 2019 almost $21 million of the Canadian CIHR, the Canadian Institutes of Health Research, over $1 billion investment by the Government of Canada into health research in this country. Just imagine if we could have only 10% matching for the National Eye Institute, what we could do here in Canada. We are world leaders in stem cell research. We're world thought leaders in optogenetics. We're world leaders in many different forms of vision research. And if we could give them a hands up, then maybe we don't have to go to 2 million people with uncorrectable vision loss. Maybe we can prevent the 13.9 million Canadians in 2050 from being diagnosed with and having vision loss happen, because we've developed new approaches to treatment. That's the power of research, and that's why in the call that when we talk to Ms. Hughes and her colleagues, and when we talk to the decision makers within Health Canada and the government, that we're asking for an increased investment in vision research. You know, I reached out to our supporters of Fighting Blindness Canada on Thursday, and within 48 hours, 300 of them responded to the survey. And unlike when Keith tells me this never happens, that you get almost 100% saying yes. Well, almost 100% of our Fighting Blindness Canada supporters said yes to a vision health plan. Almost 100% said yes to a vision health desk. And almost 100% said yes to vision research investment happening through the Government of Canada's investment through CHR. I think we are speaking with one voice, and that is to make the investment now to prevent vision loss and to restore sight. Thank you.
Thank you very much, Doug. I think now that, briefly, if I would give everybody on the panel maybe 2 or 3 minutes to discuss what the other 3 panelists said or anything that's come to mind since you've spoken. And I'll start with Keith, but just very briefly, a couple minutes, and then we're going to go to questions and answers.
I'd like to actually start, as Doug was presenting some of this data, it made me think that I'd like to just present some of our findings in the addendum that you did on the impact of COVID on the whole issue of vision health in Canada. We found, Doug talked about the importance of eye examinations and early diagnosis. We found that in 2020, there were 3 million fewer optometrist visits than in 2019. So people were not going to optometrists. If you don't go to your optometrist, you're not going to get that early diagnosis. The second thing we found that there were 143,000 fewer eye surgeries in 2020 compared to 2019. So these people, most of those, that is cataract surgery, most of those people are walking around not seeing very well. Those people need to be operated on quickly, and the whole system has to adjust in order to offset that. We need a plan for that to happen. It doesn't just happen overnight. And next finding was that about 67,000, is my memory correctly, people didn't have their injections, their anti-VEGF injections for people who currently have wet macular degeneration. Those people need mostly regular injections into their eyes, and 67,000 injections were missed in 2000 compared to in the year 2000, in the year 2020 compared to 2019. I'm sorry. Anyway, the 67,000 number is correct, and there's a number of anti-VEGF injections that were missed. If you miss that injection, you're going to lose vision, and most of the time it's irretrievable. And you put this all together, we came to the conclusion that about 1,437 people had lost vision during 2020 due to the impact of the pandemic. So these are people who've lost some level of vision. They didn't go totally blind, but they've lost some level of vision because of the impact of the pandemic. That needs to all figure into the overall vision health plan. So, Doug, if I
just add a point, Keith, on this matter. Of course, when you think about the almost 67,000 people that did not get a regular eye injection in 2020 due to the, we believe the pandemic, we know, you compare that to the United Kingdom, which has double the population of Canada, and has a national vision health plan in its healthcare service, and they had just almost 15,000 less injections for double the population of Canada. So clearly, they were able to set out that getting this treatment to save sight is critical. They had a plan in order to provide that urgency in the health system, and the number of people that were able to receive the treatment was virtually the same, just compared to Canada, where our system was not set out with a national plan, national guidelines, national objectives, agreed to work through all the work that Chad and his colleagues do in the 10 provinces and in the 3 territories to work out that national priority framework to be able to deliver healthcare that directly saves sight, because it's only a matter of weeks without not having that anti-VEGF treatment that the bleeding starts and the damage is done. And today, we're working on it, but with stem cells, but we're not able to replace those lost cells that lead to blindness.
Thank you, Doug. Carol?
Oh my, so, I'm not a professional in the vision care. I'm an advocate, but I do want to. I've learned a lot more today as well. So thank you very much to the other panelists. But obviously, we know that there's a bottleneck in Parliament with the government, and so more needs to be done in order to advance that research that's been put forward, those prescriptions that have or medication that has come out, practices. So we need to do a little bit more to reduce the timelines in processing that. And again, I think, as I mentioned, we need to do a lot more to support the researchers and to make sure that we keep them here. I think that it's I guess understandable in a way that individuals had a hard time or didn't want to go out and get their treatment or couldn't get out because they couldn't get a ride. That was a lot of times in the rural areas that we had, is nobody wanted to take that step forward to, okay, well, I got a doctor's appointment, well, okay, I can bring you. Well, no, I can't because, we're not supposed to be in the same car together, whatever, because things changed along the way. But as you said, you're not going to get that back. And I think that, when we look at the numbers from 2021, we're going to see that actually has increased quite a bit as well. And so I am very, very concerned about individuals who weren't able to get the services that they need. And we know that there's still delays in being able to get to those appointments now. The fact that, you couldn't reach someone in Parliament to help move things along sometimes was very challenging. It was challenging for me as a member of Parliament to reach somebody in the department, and or for my constituents to get services at a government office. And so just when we needed individuals the most, those services the most, they weren't there. And so it is challenging, and I guess Olha can talk about as well as some of the challenges that we've seen with individuals. And John's my staff as well. He ran over here to bring me some running shoes because I got a soaker on the way here and some umbrellas. But he can tell you about the calls that we're getting from individuals from Ukraine even, who are still having a hard time navigating through to see where to get that. And I can see how researchers have that difficulty as well, and your organizations, and trying to navigate, to get answers, to get action. And so, what I commit to you is that, my colleagues and I will do all that we can to try to put that push on to see some changes in government that will see the need to make those additional investments that need to be done, and to take action on fast tracking. And I'm not saying that we need to fast track it and not think about the impact that this could have if it doesn't work out, like if it's not the right medication, right? But if there are procedures in there, there's research that's been done in other countries that have proven to be quite successful. And so why is it taking so long for us here in Canada to approve those treatments? And so, those are things that we need to look at. And there's a huge issue. I think we're probably a little bit behind the 8 ball as well when it comes to the databases that we hold and the technology piece. So we need to move on that as well. So thank you.
Thank you, Carol. I would add one thing that we discovered when we did a survey of people living with vision loss, that were blind living with vision loss. And the one thing we discovered, and this is also as part of an aging population, and with COVID, the people that were getting on up in their ages, including me, we didn't want to leave the house. And you were hearing horror stories about the hospitals and some of the clinics and everything, and the backlogs, and people didn't want to leave the house, and they took staying home versus getting medicated. So, those are things that have to be looked at and needed to be discussed. Chad?
Thanks, Michael. I guess I'd like to speak about research for a second, just following up on some of what's been said by my fellow panelists. Doug mentioned Luxturna, which is a really innovative treatment for a disease called Leber congenital amaurosis, which is a form of retinitis pigmentosa. Mostly affects young children and quite often leads to significant or severe vision loss and eventually blindness. And Doug had mentioned that there were efforts in the UK to advance not only the treatment, but the kind of policy apparatus to make sure that the treatment would be available to individuals affected by the disease. And I think that what that demonstrates is that what we're looking for and what we need is not just funding and advancement in the treatment space, but also funding and advancement in the policy and health economic space to ensure that we have good, effective, and realistic solutions to not just push the research forward, but to also create innovative ways to connect patients to the products of that research. Because it's fine to have a really impressive treatment out there, but if we can't make it available in an equitable fashion to all Canadians who are affected by vision loss and blindness, then it doesn't really do us much good. And essentially that's the place that we're in Canada when it comes to Luxturna and also other treatments. In the UK, they came up with a strategy and a plan to make Luxturna available to a significant number of individuals. And we don't yet have that plan in Canada. So we have approval from Health Canada, but we haven't yet come up with a policy solution to make the treatment available. Hearing Doug speak about the treatment space and some of the incredible things happening in the research world also made me think about advancements in detection and prevention. Because of course it's not just about treatments for individuals who already have vision loss and blindness, it's about finding ways to advance solutions in the detection and prevention space. So something that comes to mind that is really impressive, I think, is in the world of diabetic retinopathy and diabetic macular edema, which is an advanced form of diabetic retinopathy. Essentially, the way that you can catch that disease early on is by analyzing something called fundus photographs, which are essentially photographs of the back of the eye. And there's a way for a specialist in this area to look at those photographs and to be able to tell whether or not there are early signs of the disease. Well, there are efforts underway already by individuals such as Nitin Chowdhury in Toronto to develop an AI-driven algorithm that would actually sort through those photographs without the intervention of human beings. And it does this very quickly and very efficiently so that we can find disease eyes faster than if we have a human being actually going through the photographs in a manual fashion. So that's just one example of ways that we can direct our attention in the prevention space to find some improvements there as well. And I know I keep on pulling things back to optometry, but I think that some of the things that I mentioned that were on display at the University of Waterloo fit into that area as well. Really incredible advancements in the world of detection and prevention. Lastly, just very quickly, I'm taking up extra space because Keith spoke, not very long at all. I was expecting him to go on much longer, so I'll take the extra time. When it comes to COVID-19, we're already at the point, I think, where epidemiologists and health policy experts are starting to turn their attention a little bit towards the possibility of future pandemics. And I don't want to be too gloomy here, but I think it's something that we do have to keep in the back of our minds, right? I mean, as Keith made very, very clear, COVID has had a significant impact on individuals with lived experience of vision loss and blindness. It's not just about COVID-19, it's about being forward-thinking, about being prepared, and I do think we have to imagine this kind of scenario in the future and come up with preventative measures to ensure that these individuals aren't impacted as severely.
Could I, can I just pick up on one point? So
I'd like to pick up on something too. Carry on.
So I'll be quick, Keith, because you were very short. Chad's reference to the Canadians living with this gene that could access Luxturna are not. It's not publicly funded today. It's approved by Health Canada, but it's not publicly funded. So there are 25 countries in the world that have approved Luxturna as a treatment, just like Canada has. 19 of them have figured out a way to navigate for funding of this treatment. 6 have not. Canada is one of those 6. In the 19, it's the UK, the United States, France, Germany, the ones you expect, Australia, Croatia, 17 months ago figured out how to publicly fund Luxturna. Canada is in a list with Greece, Portugal, Brazil. When you ask Canadians, you know, what would be the countries that we would think would have sorted this out, Canadians, I think, would think that they're a part of the US, UK, but we're not. And every day, Dr. Elysion tells us that one of those young children are losing 10,000 photoreceptors. If they don't have enough photoreceptors, this treatment does not work. That's why I'm quite hopeful with this Pharmacare initiative that we'll be able to work at improving the system that we have for people to access treatment. Because research is discovering new treatments, but it doesn't make a difference if people cannot access it. And that's a part of the message that we have in this Vision Health Month.
Okay, Keith, you got 30 seconds.
Okay. Okay. I'd like to link Carol's issue and some of Chad's answers. Carol, you were talking about the difficulty with getting treatment to people in isolated areas. And I think what Chad was talking about here in terms of taking photographs of fundus photographs of the back of the eye offers the solution. The solution, frankly, in isolated areas is to have non-ophthalmologists or non-GPs. You can have nurses do it, go in and take a photograph of the back of the eye, send those photographs to a center in Toronto or Edmonton or wherever, and have the disease diagnosed. Prior to this kind of technology, people had to travel from, I don't know, Kapuskasing or wherever down to Toronto to get treatment. Now they can do it through this technology remotely. And this makes a huge difference, particularly to our Indigenous populations. Indigenous populations have a high prevalence of diabetes, therefore a lot of diabetes eye disease, which you already talked about. And if you can get this kind of technology moving and moving quickly, you can do something to try and alleviate the situation.
Thanks, Keith. We had some questions, I understand.
Okay, I guess I've got the questions. First question is there a vision health model elsewhere? What are the main elements? I'll take the question.
Yeah, that's good. Thank you.
Okay. So the first question is, are there vision health strategies elsewhere? And the answer is yes. There are many countries. I think there are over 30 countries. You know the numbers.
Right. And the United Kingdom, China. I've got 5 different versions. United States,
Australia,
South Africa, and Denmark. Those are the ones I have, and there's supposedly a number.
But there are a whole bunch of smaller countries like Singapore, who have a vision health strategy for the country, and we're sitting around and don't have one.
Next question.
Next question. Okay, next question is, what is the government response to these initiatives, provincial and federal? Carol, could I ask you to answer?
Well, I'm not the government, because if the NDP was the government, it would be totally different. But, obviously, we are here discussing the challenges, and it's obvious that, that things have not moved along. You've talked about the fact that, they went to the WHO, they've indicated they'd have a national strategy. It hasn't happened yet. So, what I would say is where there's a will, there's a way, and we saw that during the pandemic, where all of this money was found to invest in vaccines, in providing other support, COVID supports. And so, this is similar. If you don't act, it's going to cost you more in the long run, right? So I would just say, that there has to be a commitment to want to be able to move that yardstick. So I think that, we can talk to a couple of our ministers, Minister Qualtrough, for example, who does have vision impairment, and you know, I don't have a problem knocking on the door and saying, okay, so where are we at with that? You know, or do we have to wait another 20 years before we finally acknowledge or not acknowledge, but respect that commitment that we have done? So when do we take action? So you know, obviously there's some challenges. Obviously there's work being done. You know, let's not say that there's not any work being done. I mean, you know, there are medication that's been asked, or treatments that have been asked to be approved. Some of them have been approved. The other thing is accessibility, as you've indicated. And so, you know, I think both at the provincial and federal level, there's work to be done to make sure that when it is available, that people actually have access to it. We need to do more to encourage. I used to work for the Canadian Labour Congress. So, you know, we need to make sure that we do more to encourage that workers' benefits, health benefits for workers are improved so that they have access, that they don't have to say, well, I can't go because I don't have coverage, right? So we need to make sure that provinces, because again, the coverage varies from province to province. Let's look at the best model out there and see what is better. But, you know, if it's whether you're going to lose your sight or whether we can actually save it, why not save it, right? Why would you want someone to lose their sight? You know, not afford them that opportunity when it's going to cost you more in services at the end of the day, and it's going to cost the economy because that person can't go to work. We've had the conversation even as to the difficulties people have in voting and being able to access services, right? How do they know that whoever they're taking with them is actually voting the way that they are wanting to vote? So, you know, because the ballots are not in Braille or anything, right? So there's a lot of challenges, and I do have some colleagues that are working on that as well.
Thank you, Carol. Is there anybody in the audience here today? Louise?
I have a question.
Oh. Louise Gillis, please.
Can you get a mic?
As a person living with vision loss, I'm here today just basically to find out answers to some of the questions. And these three gentlemen here gave you a lot of information, Ms. Hughes. So what is it that you can do to help us to improve these situations so that others, like myself, don't have to lose more sight over the next while? It's quite a long time to live another 20 or 30 years, which I would never see that, but I don't want to lose more sight over the next few years. So how do you help us get to the point of getting the governments between the NDP and the Liberals to come up with a solution to find more research dollars, a vision health desk, and all the things that we talked about today? Thank you.
Wow. I think if it was very simple, we would have the answer by now. But I think that, you know, there has been a lot of recommendations put forward. We need the recommendations acted on. We need, you know, when it comes to budgets are about choices. And so we need to make sure that when those choices are made, I mean, I think, I have to say, like every party, every politician's goal is to improve the lives of Canadians. But I think we have to put that partisanship aside, and we need to work together to make sure that, you know, the direction that we're taking is not everybody in different directions. And so we need to be more focused. And so those budgets are about choices, and we have to decide where that money is. We don't have money falling off of the tree, but when we see that there are some really impressive research that's being done, really impressive treatments out there, we need to make sure people have access to that. And that's what I hear a lot often, is that, well, we can't afford it. I'm trying to think what the condition was. It was just recently, anyhow, the person needs access to this medication, this treatment, and it's $500,000 just for the one time. And that could save that person's life. And so are we balancing the money with the person's life? That's what we're doing, right? And saying, well, you know, what do we do? And I don't think that that's the model that we should be following, is that if somebody needs something to sustain their life, then we need to be there for them. And so, you know, given the numbers that have been thrown out here tonight, I think it is evident more than ever that that investment needs to be made for a variety of reasons, right? It's about people's well-being. It's about people's ability to be independent. It's about people's ability to contribute to the economy. And there's a lot more that we can throw out there, but I mean, you know, those are the decision makers that are making that, but a lot of times it's just taken too long and things are just sitting on people's desks because we don't have enough employees to be doing, you know, doing that work. And sometimes, you know, I've had people who have worked in some of those, in certain departments, and they said, well, they're just not interested in moving that yardstick any further. It's just, okay, we will do what we can do, and it's going to be what it is at the end of the day, as opposed to just, okay, here's the case, let's just do it. So I think that we need to do much better in processing the work that is before us as well. And so just to your question, in hindsight, is we need to keep lobbying and we need to keep working on pushing that envelope.
Thank you, Carol. Are there any other questions in the audience? Keith, do you have?
Yeah, I have another question here. It's from Elizabeth I, or L. Anyway, is it your opinion that Canadian politicians have spent more on fossil fuel industries rather than publicly funded medical research and needs? This is all that you hear in the media, nothing on amazing research as Canada has.
I guess that goes to me again, huh? So on the fossil fuel, I mean, you know, certainly there are a lot of subsidies that shouldn't be, that should not be being paid out to the big oil companies. We know that they're making record profits. One of them just tripled the amount of money that they've made this year. So the official opposition's motion that is coming up is dealing with that and putting more people in putting more money in people's pockets as well. But certainly, I mean, there is, as I said, you know, budgets are about choices, and so, you know, there is a lot that we can do with those fossil fuel subsidies that we give in order to have it better reinvested, whether that is in alternative energy, into the new green economy, but also in research that needs to be done and advancing the healthcare of individuals. And that's kind of where we had went, as you saw in the agreement that we signed with the Liberals, was, okay, let's invest in dental care, because if people don't have their teeth, they can't go find a job. If people have infections, they find themselves in the hospital, which costs more. And generally, if they get lots of infections in their mouth, it also affects other organs in their body, right? So I think we're on the right path. We're just not moving fast enough.
Thank you, Carol. You got another question there?
Yeah, with that in mind, the next question sort of leads on from that, Carol. It says, what and how specifically can we do to get things moving along for us with eye disease now?
Yeah, so this is similar to the question that was just asked by, Louise. So again, you know, I think that we need to continue advocating. I will go back. I will be tabling the motion probably. I want to table it before the House rises for the summer. So we were just, unfortunately, I lost one of my staffs. He died suddenly in January, and that kind of put us behind. So now with a new staff, you know, we're wanting to table that. And so we'll work to make sure that it's as refined as possible for that motion. We need to continue raising it, you know, in the public. We have to keep it on the forefront in the House of Commons. And yeah, so, you know, there will be other budgets as well, but I think that there's always some money to be found. And just like within your professions, and within the challenges be in healthcare, everybody's vying for money. So I think that it's good that you're binding together to help make this a cohesive process. And I think we will get there eventually. Will we get there tomorrow? I don't think so, but I do believe that, you know, that we can make some advancements, and we just need to keep pushing.
Just one thing that we could ask everyone here, if you pull out your cell phones, your smartphones, and everyone that's watching this event.
I like to see people pulling out their cell phones now. I don't want to name names, but I know everybody out there.
It's stopvisionloss.ca, stopvisionloss.ca. Sign the petition so we can keep Carol busy filing petitions in the House of Commons, holding the government to account to deliver its 5-time promise to develop a national vision health plan. So that's stopvisionloss.ca. Add your name, and Carol will get it into the House of Commons record. Right?
Yep. I'm there.
I want to add a comment. Just as COVID hit, the CCB did a study and went out to our members and friends in the vision loss community, and we asked them about what COVID was doing and how it was affecting them. And the response we got is great. In fact, right now, we're waiting to go back out to them and say, this is what you thought in 2020. How did it happen? How did it work out? And what were your overall problems? But that's not the point. We took the results of that study, and Louise Gillis, as National President of CCB, Doug Earle, President and CEO of Fighting Blindness, and Dr. Jane Barrett from International Federation on Aging, because what we were finding was those were the 3 major impact. The people with lived experience, people not getting to see their doctors, and we wrote a letter. We published it in the Hill Times, and all 3 signed it. The pictures were there, and there was a letter. And that letter went on and indicated all the problems that were confronting the people with vision loss, and asking the government, the Prime Minister, the Minister of Health, Minister Qualtrough, every Prime Minister, every Premier across the province, including the territories, and every Minister of Health, speaking on behalf of the vision loss community, saying, we need your help. Now, before I go further, as everyone here knows from what I'm looking at, everybody here is probably well aware of the fact that for 10 years, research has indicated that 85% of the Canadian population think it's the worst thing they could do is lose their sight. And as Doug Earle will tell you, Mike Belarjon is patient number 1. I have type 2 diabetes. I am a cancer survivor. I have heart problems, and I've had heart failure. None of those affect the quality of life beyond having a pacemaker and a defibrillator, which I don't even think about. The only time I really think about it is the 10 pills I take in the morning and the 7 pills I take in the evening. But the one that scares me the most is the fact that I have early stage diabetic retinopathy, that I have a macular tear in my right eye, and that I just went through double cataract surgery. So the vision loss community, biggest problem, I believe, is people do not understand what it's like to be blind. People do not understand what it's like to suffer vision loss, or there would be action. Because out of all the letters that we sent, all the letters we signed, all the additional people that were brought into play, we had 4 or 5 responses from a very sharp-looking presentation. We had 4 or 5 responses, 1 or 2 within a week. Some, and it was a joke with Doug and I'd send Doug, somebody finally responded. It's April. We sent it to them on the 25th of December. So what we're seeing for the first time in the vision loss community right now is that people are working together to stop vision loss, and that blindness is preventable, and that we can work to go forward with it. So I just wanted people to know that that I believe the biggest problem confronted with us is people need to understand what it's like to be blind, and they don't. Okay? And the only people that really do are people that have lived experience. So with that, are there any more questions?
I just want to add, certainly in the past, we did have the optometrists and come to the hill, and there was, they would bring these glasses and, force us to, which forced us to understand the vision impairments that individuals have. And I think, we need to bring that back to the hill now that things have reopened. I think that we should look at doing that next year, or in the fall when things open up. Hopefully, we're not going to be hit by another huge wave of COVID. So I think that, that is something that I think that can be done again. And as well as we're into a provincial election, I would just say, you were asking what else you can do. Try to get that on their agenda at the moment. We're in a minority government. Try to work with the parties right now for them to put a vision care in their platform, to get some type of a commitment from them as well. Those are all things that, if you can get it locked in, that might be very helpful as well.
This is a good opportunity. As I wrap it up, I'll remind Doug, Mr. Earl, has had a number of dinner in the dark occasions lately, and been very successful. That wraps it up. What I would like to do is point out that there's, aside from people from the vision loss community and stakeholder groups like Fighting Blindness Canada and the Ontario College of Optometrists and the CCB here, CCB and all of us couldn't do it alone. The research that we were able to do in the last 36 months, and specifically last year, came from the fact that a lot of people stepped forward and provided the research dollars and the grants that were necessary to do that. And if I started pointing them out, they'd all get really totally ticked at me. But I would like to see everybody give a big round of applause to the stakeholders that helped fund the research that allowed us to stand before you today and discuss what we believe is a matter of crisis. So big round of applause to the funders. With that, which pretty much wraps it up, I appreciate everybody that joined us today, the people that joined us online. This will be available on YouTube and packaged so that you can pass it on to your colleagues that may have missed it. Tomorrow night is the CCB's White Cane dinner that's been moved to Vision Health Month, and that we'll be having tomorrow evening, and there'll be a full group of people speaking then. You'll be able to, you'll get an opportunity to write into the CCB's website and get a video of the gala. I want to thank you for joining us today, and have a great evening, and we look forward to seeing you next year. Thank you very much.